Okay, thank you all for joining us and welcome to this session. Thank you for joining. Standing up for abortion rights in the aftermath of Roe v. Wade, a call to action. During this session, we're going to hear from a range of partners from countries around the world about their experiences and perspectives on how we're all standing together for sexual and reproductive health and rights for everyone, everywhere. My name is Beth Schlachter, and I am the Interim Director of Global Advocacy and the U.S. representative for the International Planned Parenthood Federation, IPPF. I want to start by thanking and acknowledging the Gates Institute for opening the ICFP platform for this important discussion and inviting us to be here together to rally for abortion rights. The session was co-organized and is co-hosted by a consortium of partners, including MSI, PSI, Pathfinder, DKT, and IPAS, and we are in partnership today because we're all working for a common cause. We all know and have experienced that across the globe, hard-won human rights are under threat by a radical right insurgency, a coalition of well-resourced, ultra-conservative, far-right actors working strategically and steadily to roll back progress on gender equality and sexual and reproductive health and rights, which we know also includes a desire to deny people access to contraception. They endeavor to deprive children and young people of education about sex, intimate relationships, pleasure, their own identity, their own sexual identity and positive sexuality, and protecting themselves from harm. They attack LGBTQI rights. They work to prevent and ban access to sexual and reproductive health care, again, including contraception and abortion. And ultimately, they seek to stifle the potential of women, girls, and young people, and those of diverse sexualities and gender identities. This opposition coalition unites an array of actors from religious, fundamentalists, and right-wing populists to conservative media, white supremacists, Christian nationalists in the United States, and through Russian oligarchs and other dark and powerful business interests globally. Their carefully conceived and well-funded strategies have been successful at generating or ramping up sentiment in local communities who are at heart concerned about their futures and the safety and well-being of their children. But they're swayed by persuasive disinformation tactics as to how this can best be achieved. It's a movement that's making headway with devastating consequences for all women and girls living across the world, including in the US and in Europe. And now, buoyed by the US Supreme Court decision to reverse the Roe v. Wade law and to repeal 50 years of a constitutionally protected right to abortion for all women and people in the United States, we see a swift acceleration into Africa and Asia, where the effects can knock out decades of investment in family planning, safe abortion, and the empowerment of girls and young people. Make no mistake, this attack on sexual and reproductive health and rights and gender identity is an astute political strategy by populist leaders in their journey toward autocracy. They stoke and then leverage public sentiment on sexual and reproductive health and rights to clamp down on civil society. They design or condone policies and actions that stifle media freedom. They limit the right to freedom of assembly, as we're seeing today with tragic consequences for our sisters fighting for freedom of expression and other freedoms in Iran. And they put the safety and security of service providers and human rights defenders in jeopardy. Their aim is to hinder robust responses from feminist and women-led movements and organizations where those who fight back face regular harassment and intimidation. All of this has a clear impact on the global consensus that sexual and reproductive health and rights are human rights. Progress in the key UN processes and spaces that support actors to drive reform at the national level have been stymied and logjammed in recent years, including in the Commission on the Status of Women, the Commission on Population and Development, and the Human Rights Council. What transpires in these global processes is often cascaded down to the national level, or conversely, tested locally before they're used in UN spaces. Strategies and tactics, particularly the use of language and framing, are trialed in one space or one country and exported rapidly to another, often tested in Eastern Europe, Latin America, and the US as a prelude to their use in Africa, the Middle East, and Asia, but also going in the other direction as well. The overturning of Roe v. Wade has had ripple effects far beyond US borders, emboldening those opposed to abortion and other areas of SRHR and reproductive justice. Today's discussion will reflect on these setbacks, but importantly, we're also going to highlight positive change that predated Roe v. Wade, that has also happened since that insidious decision, including in the US and around the world. Because while abortion access remains heavily restricted in many countries for legal, policy, social, or practical reasons, for many activists and practitioners, confronting harmful norms and providing care in challenging legal settings is a daily reality. Our panelists today are advocates, activists, practitioners working on abortion in restrictive environments, our colleagues who are supporting women to have access to abortion in spite of challenging legal environments, and we'll discuss what lessons can be learned in their work. They'll share positive examples of success in restrictive settings, showing that even in the face of coordinated, loud, and sometimes threatening opposition, work can be done to advance access to abortion and human rights for all of us. So now it's my pleasure to start our panel discussion and to introduce our first panelist. She's Dr. Angela Ecole. She's the Regional Director for IPAS Africa Alliance. Angela, it would really be great to hear from you about what service providers in your context are doing to protect access to abortion and post-abortion care in a growing anti-rights environment.
Thank you, Beth, and it's such a great pleasure to be a part of this illustrious panel, and thanks for putting it together. We know that advocates for reproductive freedom and for safe abortion access in particular have always faced opposition to their work. And this opposition, as you have said, comes from extremist, misogynist groups that have fought long and hard to restrict women's rights and to control their bodies. They like to deny well-grounded scientific evidence that banning abortion does not stop women from obtaining the procedure. In fact, it only promotes dangerous alternatives. IPAS's work in advocacy includes as a critical element opposition monitoring. And opposition monitoring is a very, it's a dedicated task. It includes tracking opposition activities on a daily basis, publishing a monthly newsletter, and writing journals and articles on the work of the opposition. It's also important to understand that opposition to safe abortion and to reproductive rights is not monolithic. It comes in different forms and deploys different strategies depending on the context. Some of the strategies involve relatively harmless things like denying that there is a problem. We've seen denial that teenage pregnancy exists, and in fact, the only problem is failed parenting. I mean, that's denial. More concerning is a tactic that involves destroying and discrediting SRHR advocates and painting them as bad people that should not be talked to at all. And that is a tactic that we've seen growing in prominence. Now, the Dobbs decision that overturned Roe versus Wade has empowered national and international opposition to sexual and reproductive health services. And it's not just on abortion. It has empowered opposition to family planning. It has empowered opposition to comprehensive sexuality education. We've seen examples of heightened anti-rights action in the wake of the June U.S. Supreme Court ruling, And I think three most prominent ones that we've seen in Kenya are, first of all, a new anti-rights policy on sexual and reproductive health. And we have ongoing resistance to reinstatement of safe abortion guidelines in spite of court rulings that state that abortion is a right under the Constitution. We have also seen heightened activity against the East African Sexual and Reproductive Health and Rights Bill, which, as we speak, is unlikely to see the light of day within the next year or two. And recently, there was a very vivid example in Malawi at a conference of the African Bar Association where opposition blatantly came out to attack abortion, reproductive health care, and comprehensive sexuality education. But as providers and advocates, we know that the rest of the world is marching forward in providing access to abortion care, even as a big part of the world is regressing. And so we, as providers, are worried, but we are not cowed. We remain steadfast, and we know that while this decision may embolden anti-choice movements around the world, it has also motivated us to reassert the right to choose and to press for equitable access. And so as providers, we have decided that we shall not work in silos anymore. We must work together. Working in silos is no longer an option. We must come together as an ecosystem and fight hard to protect the gains that we have already made and to continue to press forward for women's rights to access safe abortion and to reproductive freedom.
Thank you, Angela. I really like that last call as well. Of forming common cause across silos. Funding has driven us into different corners, but we have to fight back against this. And I think it's a real wake-up call to realize that our agendas are intertwined because we're caring for people, not for issues. Our next speaker is Namakando Simamuna, and she's the Partnerships and Projects Technical Advisor for MSI Reproductive Choices Zambia. And Namakando, it would be really great to hear from you, in particular your experience in outreach to rural women as well, to share with us the context of how MSI is providing care. Thank you.
Thank you, Beth. And good morning, everyone. Every one of us here will at one point or another know someone in need of abortion care. Contraceptives may have side effects and sometimes fail. There are people who have no say on when and if they have sex. Family planning alone will never be enough. We know that women that seek safe abortion services still have limited access. They may not know what the law permits, and sometimes are far too worried about the social stigma that comes with the service. MSI Reproductive Choice exists to ensure that women and girls are not alone in their choices and to ensure that they access safe and high-quality abortion services that provide choice and quality information that is enabling and empowering. As one of the largest providers of safe abortion, we have learned that it's important to leverage the different parts of the healthcare system, from private to public providers, and even self-managed care. So what have we learned over the years from our work and from our partners? That one, we need to ensure that services are available to all women where and when they need them. And this means working with partners from grassroots to government institutions at different levels and private sector to support the ecosystem that supports women's access to comprehensive and safe abortion care. And these services must be provided at the women's terms and within their communities. We've also learned that secondly, this access must be sustained through social business models, such as the multiple clinics available at different points of service delivery, but also through building capacity of public providers to provide comprehensive abortion care. And ensuring financing, and that is both public and private financing for comprehensive abortion care. In Zambia, most recently, and for the first time ever, private health insurance has reimbursed abortion services. Three, we have learned that it's important to provide real individual choice. And real individual choice means choice in method, choice in location, and choice in provider. But this also means recognizing surgical methods as part of the continuum of care for women that choose medical abortion. We have learned that it's very critical to maintain a cadre of providers that can provide surgical care. But we've also learned as MSI reproductive choices that it's important to go beyond harm reduction and try and understand better what women want within the health system. Fourth, we've learned to make sure that it's important that women know where to access services and they also know their legal rights. This means talking openly about abortion, demystifying the myths, and making sure that women know exactly what the facts are around abortion. Fifth, we have learned that it's important to remove unnecessary legal and policy barriers. We know that legal and policy barriers marginalize women and further stigmatize and deepen inequalities. Some governments have recognized the magnitude of this matter and have made real action. The government of Nepal, for example, has recorded about 50% reduction in their maternal mortality after liberalizing abortion care. My own government, Zambia, has begun to explore the use of telemedicine to enhance access to comprehensive abortion care. We believe that telemedicine and other digital platforms are such a great opportunity to enhance access and ensure that we provide services that are client-centered. Now, despite government commitments, it's sad to note that investment is still sadly inadequate. The amount of progress being made is nearly not enough to meet the current demand. We have commodity shortages that are threatening some of the gains that we have made so far. And the biggest threat we're experiencing is the funders that have majorly supported abortion work over the decade, pulling out of supporting direct service delivery. And our call today is that while government and donors are having this critical conversation around scarce resources, it's important that they interrogate and sort out the tension between meeting the current need of abortions today and looking at the long-term need to remove policy restrictions and strengthening healthcare. Governments, donors, and advocates should work together to ensure that equity and access are at the heart of the development agenda, and that access is enhanced, especially for the rural woman. When we achieve this, we'll not only eliminate unsafe abortions, but we're going to change the whole discourse around abortion to ensure that it is not under the control of the states and medics. Thank you.
Thank you, Namakando. Well said. I particularly appreciate that you highlighted the range of ways that people now have access to abortion care, from digital and telehealth, medical abortion, and surgical abortion. They all remain critical. And I know that that's something that DKT does. And our next speaker is Kwesi Boyasin, and he is DKT's country director for Ghana and also the regional director for Anglophone West Africa. So Kwesi, DKT has a reputation for really going into places that other people aren't serving and to finding new and innovative ways of providing services. So I know the audience will be really excited to hear from you about your experience given the range of laws and legalities for abortion in West Africa. Thanks.
Thank you, Beth. Good morning, everyone. So I'll start off by saying that the social marketing organizations and what we do isn't necessarily the panacea to addressing the challenges with access to services or products, right? But what we do forms a very big part of contributing to making the commodities available for our women and girls to be able to access them wherever they are and where the law permits. And so a lot of things that government has done has been within the public sector. But what happens to the private sector? What happens to the woman who has no time to or doesn't feel comfortable going to the public space and wants the private sector interactions, right? And that's where SMOs come in. What we do is a very solid part of getting access to commodities. So we are able to, so government, and I'll use Ghana government for as an example, where they are not able to procure MVA kits or medical abortion pills because it's not on their essential list, right? But that's where we come in as social marketing organizations. So we make these available. We make them available to the farthest of places. So we recently, for instance, in Ghana, moved away from just the 10 regions we were in and moved into 16, all the 16 regions where we have our sales personnel, our medical detailers, going from the approved outlets and facilities that we could put these products in. And that's not the only thing we do. We also have, even on ground, community representatives who now go into communities to educate, sensitize women on their rights to these services and where they can find them. We've also linked them to even our contact center that now is able to tell them, based on where they are located, which facility, which outlet they could go to and get a service and a proper service, right? So you, I don't want to move away from what my colleague speaker spoke about concerning Zambia. It's if you don't provide a proper service to a woman, she's going to definitely find a way, and that's what that's one of the factors that is leading to the maternal mortality rates that we are experiencing, right? So there are lots of things that social marketing organizations are doing to support the effort of government. And so we have barriers, and some of the barriers include our inability to take the products to where we have to put them. So in Ghana, for instance, we have been allowed only to put the MVA kits in the right hands, which is the ethical thing to do. But the pills, which are supposed to be medication, self-care, is supposed to also be administered through an approved list from our regulators and the Ministry of Health. Fortunately, the Ministry of Health sees the importance of what we bring to the table, and so they quicken their steps in approving facilities that we bring to them for access, right? So we go as far as a place in in the Western North, where you would have to travel several kilometers to just get to a CHIPS compound. But then what happens? You get there and then there isn't a trained service provider. So what we also do includes building capacity, and this we do in partnership with government. So we facilitate because they have the master trainers, and we bring together the service providers from the places where you would hardly find service providers, get them trained so that once the facility and the people there have the right and registered products, there's also a service provider who's been trained and has been put through the IPAS values clarification session. So they know how to counsel, they know how to make the women feel comfortable and go through a proper service. So social marketing organizations do all these things in support of what government is already doing in the public sector. And so we play a very key role, and we are always for the rights of the woman and the girl to get access to all the methods, including having access to safe abortions when they want it and when the law permits. So I think if we keep looking at the challenges, then we will sit and not do anything. And that's why we take it to the regulators, to the people who are in charge, all the stakeholders in this value chain. And we ask them for the necessary support, which is, for instance, allowing us to expand the access, allowing us to keep our women getting what it is that they need, so we don't continue reporting the high cases of maternal mortality. So we would continue doing what it is that we do now, and continue to collaborate with the government and all the stakeholders in the value chain, and then make sure that we deliver access to, and then the commodities to the woman and the child who needs it.
Thank you.
Thank you.
Thank you, Kwesi. I think that's one of the things we all appreciate about DKT is that entrepreneurial attitude. There's a challenge, there's a blockage, let's figure it out, let's work in partnership, let's go forward. And that helps really lead the way so government can also follow. So our next speaker is Dr. Anupama Rao, and she is the Senior Technical Advisor for Pathfinder India. And Dr. Anupama, I think it would be great to hear from you as well. India's long had access to abortion, but we know that's expanding, and we know that social stigma and other stigmas and blockages are in the way, regardless of the legality of a service. So love to hear from you about how access to abortion in India is evolving.
Thank you, Beth, and it's a privilege to be a part of this panel. Half a century ago, in 1971, abortion was made legal in India. And as of now, India is one of the very few countries that have highly progressive laws for abortion. Abortion in India can be done for wide, broad grounds. They may be social, eugenic, therapeutic, or humanitarian. So to give you an example, some of the obvious provisions for abortion are, of course, saving the life of the woman, for pregnancies that may cause health risks, life risks to the woman, or pregnancies that would lead to serious handicaps for the child, or sexual violence, pregnancies due to sexual violence. These are some of the obvious provisions. But what India also acknowledges is that unintended pregnancies are the real sad fact of life, and as is contraception failure. So including the provision of contraceptive failure as one of the grounds for abortion makes it very liberal for women to access safe abortion in our country. And as a provider, even a condom failure or a withdrawal could be ticked off as a failure of contraception, and the woman can be given services. So India has 15 million abortions happening every year. And unsafe abortions are still the third leading cause of maternal deaths in our country. So very recently, last year in 2021, India felt the need again to reform and make some progressive changes in the law. So there were many reforms that were brought in last year, but I would like to talk about a few of them. Firstly, abortion was allowed only for married women. And India acknowledged that need of an 18 or a 19-year-old girl running from pillar to post, being denied an abortion, all because she was unmarried. So now the law allows married and unmarried women to access abortion under grounds of contraception failure. The second is increase in the gestational upper age limit from 20 to 24 weeks. So if you, for certain vulnerable categories. So to give you an example, a minor girl or a mentally challenged woman who's been raped, she may not even realize that she is pregnant until she is well noticeable into her 6th month. So adding that 4 weeks is like a big relief for providers to offer abortion to such conditions. The third one I would like to talk about is fetal abnormalities. As we know, some of the fetal abnormalities are not detected quite late, even beyond the 20-week limit. So you take a situation of a woman who is 25 weeks and the ultrasound has just diagnosed a severe cardiac abnormality in the fetus, which is not compatible with life. And as a provider, I just need to tell her, I was supposed to tell her earlier that I cannot offer you an abortion because not legally allowed beyond 20 weeks. And you just have to carry the pregnancy next 15 weeks, deliver a baby who may die within a couple of hours after birth. So India acknowledges this trauma of the woman. And now the present law, there is no upper gestational limit for substantial fetal abnormalities. And abortion can be done with opinion of a medical board, even beyond 24 weeks. So these are some of great progressive laws which are helping providers to Apart from that, there are laws, the changes which address confidentiality, there are changes which address health workforce shortages. So overall, I think India has made sure that comprehensive abortion care is given, ensuring justice to the women. I would like to say that several grassroots level organizations, women's groups, and NGOs, they have worked tirelessly with ministries and stakeholders to make sure that this change happens. So I think forums like this are so important to make our point to the lawmakers of the world, to understand the reason that these are real situations of women who are, not deserving of closing the doors against them. So outlawing abortions is, as one of the experts said, outlawing abortions is not going to end it. It's just going to kill more women who will go and access unsafe abortions. So I think at the end of the day, there's only one victim to the abortion debate, and that is the woman.
Absolutely. Thank you, Anupama. And I think that really important process of bringing evidence to lawmakers is so critical, because we know that people will deny evidence. We know that based on their own personal beliefs or other desires, they'll push back against that. And so the constant process of both providing services and then relentlessly providing that advocacy and that evidence to lawmakers is just something that we're all going to have to do year after year, far into the future. It's a tireless process, but I know everyone here is really committed to that. And in that sense, I'm very excited that we have one of our youth advocates with us as well, because we're going to have to keep going, and we need every generation to work in solidarity in order to ensure that we have services. So it's a pleasure to introduce you all to Maya Vicencio, who's the Monitoring and Evaluation Officer for the Family Planning Organization of the Philippines. And Maya, please give us your perspective on how young people can work in advocacy for abortion and the SRHR agenda.
Okay, thank you. Thank you, everyone. Thank you so much for this panel. So, my name is Maya Vicencio, 25, Philippines. Okay, so I just really want to take a step back and just sort of define, or what I feel that what the youth is, or who the youth really are, because we often lump youth or young people to an age range, or define them as an age group as 18 or below, or 25 and below. But really, youth and being young is potential. It is the willingness to change and the willingness to be open to change and to transform. And this really is a key component of activism, especially in the context of abortion. And this really goes beyond any age range. So when we say young, we really do mean young at heart. So I really hope this touches some other people in that way, because being youthful is not just being strictly defined as 18 and below, but it is really, you being young is having potential and that willingness to change. So this sense of transformation is really a core component of activism, especially in the context of abortion, where it really isn't an easy fight to begin with, especially in the Philippines, where we have some of the most restrictive and most heavily penalized abortion laws in the world. It's a really tough fight, especially it being a highly stigmatized concept as well, especially in the age of misinformation. We are experiencing a lot of small wins in our own context, and especially coming from a young person perspective, in such that abortion is getting a lot easier to talk about, and that young people are actually most supportive of the notion. And I think, going back as well, this really stems from a willingness to actually understand the context and actually come from a place of critical thinking, and leaving our personal beliefs just to the side, and really just assessing the situation for what it is. Because a lot of young people, we really get that stereotype that we are all talk with no experience. But I think in the age of digitalization, with access to so much information, it's really a lot easier for anyone to just understand what is going on with just a quick Google search or anything. We often lump ourselves to this type of stereotype, so we really find it in ourselves to go beyond that and do some critical thinking, and also empathize with other people in that matter. So it is a lot easier to talk about concepts as difficult as abortion, especially right now. So I think a big thing for our generation as well is that for a lot of us, it is also our first time voting. And it's a lot of our first time actually participating or having this mass participation in national discourse and like a national level place of concern. So I think many people have actually underestimated our power in numbers and how many we actually are and how many opposition or opposition-minded persons are actually from the youth sector themselves. So it is really a great place and a great space for responsibility for making decisions that actually affect the national level concern. So just going back to the context of abortion, in such it really is the ultimate expression of making decisions and having ownership over one's space and one's body. It's just, I know that, or we know that we are not alone in this concept, or we are not alone in thinking like this. So I really want to take this space to urge other young people as well, other young people at heart, to really claim their voices and find that ability to transform and lead to another spark of change and really make empowered decisions over our own bodies and other people. So it's that short and sweet of what I'm going to say. I really hope we end on an empowering note and really help create spaces for our young people, because we are here right now. We are now making decisions that really do affect other people, and I really hope that we have the space and that we actually own our spaces to make more empowered decisions over our bodies. Thank you.
Thank you, Maya. I think we're all counting on you and counting on that, both that youthful spirit and that activism. And we know there are big numbers, and the fact that people are getting politically motivated at a younger age and being really committed is what's going to provide that space for progress going forward. And thank you all for encouraging us not to calcify in our beliefs, and for flagging that opposition exists among young people too. And so among your own cohort, you'll be doing that same work that we're all doing as well. In that spirit of activism, I'm really pleased to introduce as well our last speaker today, Marta Arroyo, who is the Executive Director of Pro Familia Colombia. And we wanted to come from this panel to raise awareness that we're all experiencing around this opposition, but to demonstrate that there's a way forward, that we know what to do, we know the power of social movements, we know the power of activism, and that collectively we can continue to make this change. We may lose ground sometimes, but it doesn't mean that we won't keep moving forward. And so I'm very excited to hear from Marta about the Green Wave in Latin America and the power of feminist movements. So Marta, over to you.
Thank you, Beth, and everybody for being here. And I'm so excited that Maya came before me, because you know that what I want to share with you are some of those lessons. Some of them have been hard, but others have been very, very amazing to feel. And the first lesson that we have gathered for the Latin American process is one of hope. And you mentioned it, you know, because what we have seen is that even in those places where there is the highest opposition to abortion rights, the hard work and long-standing commitment of donors, civil society organizations, even decision makers, you always find a partner that wants to work with you, health providers, grassroots organizations, do make all the difference, you know, and just look at Latin Americans' road on legal abortion. It has truly changed over the 10, 5, 3, and lastly in Colombia this year. So, you know, as a region, we really feel and empathize with what has happened and all the struggles and efforts that you are carrying out in the United States, but also other regions and other countries. But, you know, you said it, Beth, this is about collaborative strength, you know, and that's where hope comes. Another lesson that we have learned has to do with, you know, understanding that change is not a flat road. It's more like a zigzag with wins and losses. But that ability to understand change and openness has also made us more creative, innovative, clever. And what that means for us is being resilient. Yes, Some blows are really, really hard. And Roe versus Wade has been one of them. I remember that every single day we were looking at the news, and some people do not even understand English by looking at CNN, but we knew every time Roe versus Wade came on the screen, something bad was happening. So as a region, we were there with all of you. And I think that's really, really important, because this is where these spaces are all about exchanging these lessons and how can we build on the knowledge, the good, the bad, and the ugly. But good things happen also. I would like to just share with you very quickly some of the challenges that we face before we arrive to Colombia's last ruling that depenalized abortion up to 24 weeks in February of this year. And, I think that the first hard work that we went through was to look at ourselves as an organization, because I think that before you try to convince the world, you have to take a hard look at yourself and understand how are we doing things. And at that moment, when we started saying, okay, we have to move forward abortion rights in Colombia, the first thing that we did was to create what we call the Program for the Prevention and Attention of Unwanted Pregnancy. But that program went beyond just the provision of abortion services. What we did there was to take the whole organization as a whole and look at how were we employing people, what were the conditions, were we explaining to them that we were a pro-choice organization that were focused on providing abortion services, our access routes, how fast they were, how many paperwork the woman had to fill out before accessing the service. So we went into all this revision, and the changes started happening there. After that, we say, okay, we are ready. We have everything that we need. So now we're going to start advocating, participating at the Constitutional Court, sending them evidence. And the first evidence was from the stories of the women, girls, adolescents, and transgender people that were coming to our clinics facing barriers from the whole system, even though we had a really good abortion law. We gathered all the stories, but also included some of the stories from the health providers, because they were also suffering from, discrimination and prejudice, even sometimes from their partners at work. And we gave them voice at the Constitutional Court. And I think that made such a big difference, And from that, another lesson that we learned, very important, is that we talk a lot about working with people, centered person approaches. But what that really means is not designing a roadmap, it's not designing a process, it's about developing empathy, truly listening to them, putting yourself in their place and feeling what they're feeling, listening to the stories of pain, suffering, and cruelty in the health sector. And that meant for us, and it's not at my level or even my manager's level, but every health provider of Pro Familia has to go through a training that first focus on empathy and emotional intelligence, and that has made such a big difference. And when those stories finally reach the Constitutional Court, we feel that it really touched them, Something else that we think that is it was kind of a difficult lesson to learn, because there are very few resources, research, data, numbers. They kept asking us, give us the numbers. How many illegal abortions do you think are still happening in Colombia? We do not have those numbers because those are illegal places. They do not report, they do not register what they're doing. But I always tell them, just cross the street, across one of our Familia clinics, and you will see there the illegal clinics. They are so illegal that they're painted in the same colors Pro Familia has. So I said, if they are there functioning, that can give you an idea of how many illegal abortions are happening. So we have started gathering qualitative and quantitative, doing qualitative and quantitative research in order to, have better number, statistics, and data so that we can start really measuring the amount of illegal abortions that is happening in Colombia. So another lesson that we learned, and I'm going back again, during these 3 days at the conference, I've been stopping every single day at the Safe to Choose booth. And you know why? Because it's about abortion, but it's so much fun to be there. And this comes down to the narratives. How are we talking about abortion? And we know how hard it is. We have faced it, and we still face it in many places of Colombia. But we have to start changing our narratives and being able to speak out of abortion as another health service. That's what it is. We need to make that happen. So many things, I think, will come for the region. You think that now that we have the law, that's it, here we are ready to provide the services. No. One thing is what happens on paper, another thing is what happens in Quibdó, in the Pacific coast of Colombia, or in La Guajira, which is comprised mainly of indigenous community. People do not know yet. Women, girls, adolescents, transgender people, they do not yet. There's a lot of people in Colombia that have no idea that abortion has been depenalized up to week 24. So we have first an obligation to communicate, to inform in simple, easy to understand ways all around the country. Another thing that we need to keep on doing is we think that when the ruling came out, our clinics started filling out because access is so much easier now. Our capacity is up to almost 100%, but it's not like asking which doctor in the country wants to come and do abortions. It doesn't happen like that. So we started working with universities because we need, first of all, to explain to them what rights means, what an abortion right means, and what is the law in Colombia. So that's going to be quite a challenge. What comes for the region, next? I think that we have to keep on working at different levels. If you go to see Central America, some countries there are, I would say that is like cruelty laws, treating girls, especially girls, really, really bad. In countries like ours, where we have a better regulation and norms, I think, as I said, more training, more information, more working with the communities, with young people. Young people are so important because their voices are really carrying, a very strong message, and governments are starting to listen. I think that something else that needs to happen, the public system. In our case, in Colombia, the private sector, NGOs like ours, are taking care of everything. We need to work with the public system and help them develop their own trajectory so that they can also start providing abortion services. And my last comment is that we are here with you, with each one of your stories and your pains and gains. Latin America is a region that is very well known for its activism and, again, creativity and innovation. We have the same pains. You are not alone. There are good examples, amazing knowledge that has been gathered. And what I think that's what it's all about, the power that we have as one. And that's the way we feel. Even, all the way in Thailand, which is really far away from Latin America, there are very few of us present here at the conference, but all of us represent a lot of organizations that are feeling what is happening and are ready and more than glad to contribute in every way we can, advocating, making sure that services are provided and that young people is included in the conversation. Thank you.
Thank you, Marta, and thank you for really talking about empathy, compassion, and solidarity. As a panel, that's what we wanted to bring to all of you. That we're all working in very specific local contexts, and we're facing opposition and stigma in culturally specific ways. But there's a commonality to all of this that can help us learn from one another and that binds us together as a community as well. And so it's just been an honor to be here with all of you, and I want to thank you for that. We don't have time for a second round, but I did want to end with one last comment as well about what that solidarity looks and feels like a bit from the United States. You all know that we've undergone a series of traumatically shocking experiences in recent years. It's never good for you to do that, but it's not a bad thing for Americans to have to recognize who we are as a people in our core and the things that need to be addressed that we can't ignore anymore, that we have to address those things and to take down that concept of what I've always felt to be insidious of American exceptionalism, and rather to look at the fact that America is comprised of people from everywhere, but we do have a unique identity that brings both good things and bad things, and it's time to clean our own house. And in recognizing as well that it's now Mexican women who are providing services for poor women who are living on the border. That fact alone has been a profoundly shocking narrative that really calls on all of us to recognize that it's people who are accompanying and helping one another to get through this, and that's going to be our way forward as well. And so in terms of the impact that it's having in my own country and then that ripple effect that it's happening around the world, it's really something that's difficult for us to come to terms with, but something that we must do. And I hope that we will, and I hope that that's what will come out of the process that we are going to go through or that we're going through in the United States. So with that, and with that moment of solidarity and hope, because what we wanted to do was really take a hard look at what opposition means, because it's everywhere, but to also know that there's a solution in every single place, in every community, in every country, and that as we learn from and inspire one another, that we will move forward. And so the last part of what our session is that we're going to invite a range of other colleagues on to give you their commitment. We put together a call to action that's based on the Global Safe Abortion Dialogue's work. And I have two colleagues now that I want to introduce who are going to moderate this session of the call to action. And as they're speaking, we hope that you'll all be thinking in your own hearts and your own minds about what you're going to do and what your organization can do as well. So now it's a pleasure to hand the microphones over to Essie Asare-Pra, who's the Advocacy and Donor Relations Manager for MSI Ghana and an ICFP Youth Trailblazer, and Dr. Millie Kagwa, who's the Senior Clinical Advisor for Africa for PSI. So Millie and Essie, the floor is yours.
Thank you, Beth. It's good to be here. Hello, everyone.
Hello, everyone. Thank you. We shall just. Sorry about that. So we shall read out the call to action which is behind you so that you can hear it, but you can also read it with us. We call upon governments, donors, and international community to urgently stand up for abortion rights, taking the following action. And the first is to ensure universal access to high-quality, non-stigmatized, person-centered abortion care for all, including young people and people in humanitarian settings, through a comprehensive range of pathways to care that maximize choice, including access to medical abortion, commodities, and opportunities for self-managed abortion, MVA, and in-facility care.
And two, to decriminalize abortion and create a supportive environment for abortion care, including countering organized opposition and harmful norms through strong and coordinated advocacy movement.
Thirdly, to provide responsive long-term funding for abortion care that supports innovation, strengthens health systems, and creates sustainable change, including support for civil society and grassroots movements.
And last but certainly not the least, to recognize abortion as a human right and ensure that abortion is mainstreamed in all sexual and reproductive health and rights, health, and human rights programs, including integration within universal health coverage and broader health systems.
So with that, Essie and I have the pleasure to invite a few distinguished guests to the podium, all of whom are committed to advancing sexual and reproductive health rights for women.
The first person that I have the honor of inviting to the podium is Her Excellency Bjork Sancher, State Secretary for International Development, Norway.
Thank you. And dear friends, let me take you back to 1994, the International Conference on Population and Development. The then Norwegian Prime Minister, Gro Brundtland, gave a groundbreaking speech where she argued to decriminalize abortion. The reactions that she received were massive, strong, and negative. Since then, we have made some really important lessons in how we can organize and work together, civil society, academia, faith-based organizations, and us as governments, to make progress. And we've seen progress. We've seen more progressive legislation being adopted in many countries, and we've seen more women and people who need these services have received safe abortion services. But right now, we are experiencing, again, a massive pushback. And we've heard it articulated very well from colleagues in the panel. The pushback is strong, well-funded, well-organized. It's, again, an attack on our rights to decide over our own bodies. And it's part of a broader pushback against liberal values and free democracies. And that's why it's so important that we build on those lessons that we have learned and how we can organize and work together in partnership to protect rights and freedoms at the global level as well as in communities. And drawing the line back to 94 and coming fast forwarding to the present day, Norway still commits to strengthening access to safe abortion. We know that restricting access to abortion does not prevent people from seeking abortion. It only makes it more deadly. And that's why Norway commits to continuing to strengthen access and sign on to this call of action. Thank you.
The next speaker I would like to invite is Sarah Thompson, the lead policy specialist for health and sexual reproductive health, Swedish Agency for International Development, on behalf of the Global Safe Abortion Dialogue Committee. You're welcome.
Thank you. It's actually for sexual and reproductive health and rights. The Global Safe Abortion Dialogue has gathered activists, service providers, implementing partners, policymakers, funders, and other stakeholders at global, regional, and national levels since the first meeting in Stockholm in 2016. And the latest GSAD was held virtually in April 2021, when over 650 individuals representing 250 organizations from over 50 countries attended. I'm here today humbly representing the GSAD committee, including the donor circle, and we strongly support this call to action. It reflects the agreed upon priorities from the 2021 GSAD, which are intersectional and inclusive movements, responsive and flexible funding, person-centered quality abortion care, more and greater coordination, supporting risk-taking, advocacy and accountability, countering the opposition, and abortion in humanitarian settings and adaptation for resilience and preparedness. The right to health can never be realized without universal access to safe abortion. And finally, for those of you on Twitter, hashtag SRHR and UHC. Thank you.
Thank you so much, Sarah, for that commitment. And now I would invite Miles Kempley, Executive Director of Sexual Reproductive Health and Rights of the Children's Investment Fund Foundation.
Thank you. incredibly pleased to be here, and I want to share that CIF has invested in safe abortion care since 2016. Our founder and our whole team are completely committed to this work and making this right central to our approach to comprehensive sexual and reproductive health and rights. We are sharing today that we will absolutely continue focusing on three areas that we have been steadfast on, including the rights of adolescents and young people to access care, improving the quality and affordability of medical abortion, and the work that we collectively doing to strengthen our ability to counter the opposition. But I'd also share that we need to go far further, and quite frankly, we're incredibly worried about the changes in funding that are impacting or have the potential to impact frontline care. We call on all of us to strengthen health systems, really support a diversity of partnerships to deliver access, including the vital role that the private sector plays to support access to care. And we call on all funders too to break down the barriers that exist between family planning and safe abortion care. Thank you.
Next, I would like to invite Poonam Matreja. She is the Executive Director for Population Foundation of India. Thank you.
Population Foundation of India has always been committed to every sexual reproductive right of a woman, including abortion. And when Roe versus Wade the judgment was a major overturn, it was a major setback for the movement to protect women's reproductive justice. We spoke up then, we continue to speak now, and we commit to the call to action to not only work in India. The unfinished agenda is still there in India, but we commit to work globally, and we stand in solidarity with our sisters, not just in America, but across the world. Political commitment and safe environment for abortion services to ensure the last mile coverage, notwithstanding a woman's marital status, caste, class, race, or gender identity. In India, we heard the good news from Anupam, where married and unmarried women will have equal access. We wish that for every married and every unmarried woman, and commit to work on that globally. The Indian Supreme Court has made a historic judgment and also recognized the deficiencies in the abortion care services, and we want every court in the world, every judge to recognize that. They ask us to abstain. We ask those who make regressive laws and turn down progressive abortion rights, we ask them to abstain from interfering with women's rights, reproductive rights, and abortion rights. We commit to ensure universal access to abortion, which is a fundamental right, and let's recognize a core component of family planning, which is embedded in the principles of equality and equity and justice. We will not rest till we collectively change the world for the women. Thank you.
Thank you, Poonam. We certainly will not rest. And now I invite Martha Smith, Director of Reproductive Health Supplies Coalition.
Thank you. So on behalf of the Secretariat of the Reproductive Health Supplies Coalition, we're very proud to support this critically important call to action. I'd like to just speak quickly about how this is manifested in the work of the coalition in three very important ways. Firstly, our Safe Abortion Supplies work stream that's driven by the priorities of our members has been and will continue to be the go-to hub for new information, for collaboration and connection on safe abortion supplies. Secondly, we really do believe that our soon-to-be-released learning course, available in both English and Spanish, on the quantification of safe abortion supplies, that is very much aimed at ministries of health and non-governmental organizations, is coming out at really such an incredibly important time. Thirdly and lastly, our Innovation Fund is supporting the first quality-assured combi packs available in 3 African countries, as we also look to work with a new manufacturer of a combi pack in the Latin America and Caribbean region. Abortion is healthcare. Thank you.
Next, I'd like to invite Basi Nyambi. She is the Director of Partnerships and Engagement at Planned Parenthood Federation, America.
Hello, hi. I'm with Planned Parenthood Global, which is the international arm of Planned Parenthood Federation of America. And on behalf of our colleagues in the United States, Africa, and Latin America, I'm here to say that our commitment to backing brave partners, allies, and advocates to strengthen our locally led, globally connected movement is stronger than ever. And as part of this commitment, we will continue to defend and advocate for sexual reproductive health and rights for all, including abortion, LGBTQ+ rights, and human rights. We have been working and supporting our local partners for 5 decades. And as part of our new strategy, our new Backing the Brave strategy, we will lean into youth movement building and fighting the opposition. We need more young people in all our diversity leading organizations and spaces like this. And we really need to lean into not tokenizing and siloing our youth movements. And as we work together, we're working to permanently repeal and end racist and neocolonialist policies like the global gag rule that hold back our global movement. We will not let rollbacks in the US define the incredible achievements that we as a movement have made around the world, including in places like Colombia, in Mexico, Ecuador, Burkina Faso. And together with the courageous people in this room, it's really upon us to fight, take back power, and continue to expand access to sexual reproductive health and rights for all. And again, we won't back down. Thank you.
Thank you, Basi. We would not back down. Now I invite Sarah Onyango, Director of the Self-Care Trailblazer Group.
Good afternoon, everyone. On behalf of the Self-Care Trailblazers Group, a global coalition of over 650 individuals who are committed to expanding our safe and effective practice of self-care, we'd like to support the call of action today. The SCTG supports the adoption of WHO guidelines on self-care interventions for health and well-being, and also the recommendations on self-management of medical abortion. We believe that self-care for SRHR can serve as a critical entry point for transforming the users and health systems experience for health, especially reaching women and girls, adolescents and young people, and other populations that are underserved by the health systems. The SCTG was established in 2018 with support from SIF and Hewlett Foundation, And we want to ensure that self-care is institutionalized into policies and integrated into national health system. We want to commit to use the power of the coalition to advance self-care for SRHR, but specifically including for abortion care, for safe abortion care. We want to grow and mobilize our membership and our networks to advocate for policies, for resolutions and financing schemes that advance self-care for SRHR and ensure that self-managed abortion is included in comprehensive SRHR packages. We want to apply the expertise we have, including knowledge, evidence, and learning resources that can be adapted within country contexts to increase awareness of the safety and effectiveness of self-managed abortion. We want to partner with major global health provider associations to build support for comprehensive packages of SRH self-care interventions, including self-managed abortion. And finally, we want to build awareness and support amongst policymakers, implementers, and other key influencers to increase commitment and support for self-care for SRH, and especially including for self-managed abortion. Through these efforts and the power of their coalition, we can build a global support for self-care that ensures that self-managed abortion is an essential part of safe abortion. Thank you very much.
Thank you. Our next speaker is Amalia Handiani. She's the Asia Outreach and Development Coordinator for Women on the Web.
Hi. Women on Web is supporting this call to action. Abortion care is a collective care, and this reflects a chain of solidarity. For more than 70 years, Women on Web has been providing information and access to safe abortion through mail to all women and pregnant persons for whatever gender identity they have, for whatever reason, wherever country they live in, whatever age they are. This is their rights, your rights, and our rights. Women on Web has started to provide advanced provision service to facilitate women and also potential pregnant persons to get abortion pills for future use. This will normalize abortion and create another chain of solidarity so women and pregnant persons can have safe abortion with respect and dignity.
It says their rights, your rights, and our rights. Thank you, Amalia. Now I invite Julia Bulos, Chief Operating Officer and Trustee of the Bestrom Foundation.
Hello, everybody. Thank you for inviting me here. I'm very humble. Compared to everybody else that's here right now, we're a small foundation based in the United States. We've been working since 1982, just providing sexual reproductive health and rights projects. We reach marginalized women in Latin America and East Africa. Now, after everything that's happening in the United States, our support is bigger in abortion. As advocates for access to safe abortion care, we remain committed to comprehensive abortion care, post-abortion care, and are continually inspired by our partners who work tirelessly to ensure that their clients receive the care they need. Today, I just wanna, I want to commit to this support, and we'll continue working hard, making sure that women get the services they deserve. Thank you.
Next, I'd like to invite Mitchell Warren, Executive Director of AVAC, Global Advocacy for HIV Prevention.
Thank you. Thank you so much. And why, you ask, is someone from an HIV prevention organization here? Because we must all be here and stand together. As a global organization dedicated to health as a human right, to social justice, and to individual autonomy and choice, AVAC stands proudly today and always for abortion rights and reproductive justice. In June, we joined all of you in condemning the outrageous decision from the U.S. Supreme Court, which rolled back decades of protection for those seeking safe abortion services in the U.S., and it undermined landmark rulings that safeguard fundamental human rights, privacy, and personal liberty, not just in the United States, but everywhere. The US court's ruling harms public health everywhere, full stop. We know that access to sexual and reproductive health, care, privacy, and bodily autonomy underpin not only abortion rights, but also the ability to combat HIV and end this pandemic. We are HIV and global health advocates and activists, and our work is fundamentally about intersectional social justice and human rights and the unyielding commitment to choice. Choice in contraception, choice in HIV prevention options, and choice and access to safe abortion and post-abortion care. Without these choices, we cannot succeed. These issues know no borders. It is never about abortion or contraception or STIs or HIV, and it's never about the US or any one country. These are cross-cutting global issues that affect us all everywhere. So we stand today and always in solidarity with the sexual reproductive rights and justice communities and leaders who are at the forefront of the fight for reproductive rights, and with everyone whose lives will be fundamentally altered by the heinous US Supreme Court decision. We commit to working with all of our partners and with all of you as allies to ensure that the rights to abortion and to reproductive rights overall are protected for everyone, everywhere.
Thank you. And now I invite Dr. Suchitra Dalvi, co-founder and coordinator of the Asia Safe Abortion Partnership.
Thank you for the opportunity to speak up here on behalf of the network. Safe abortion rights really need to be located in the context of gender and sexuality. I really appreciated what the speaker before me just addressed. And we genuinely believe that we can truly address the stigma and the challenges to access only when we recognize the political landscape, which includes an intersection of multiple oppressive frameworks, such as patriarchy, capitalism and neoliberalism, and post-colonial reform, as well as the hegemony of healthcare services with inherent misogyny in medical teachings. And I speak as an insider, as a gynecologist. ASAP is working proactively to build inclusive movements with other social justice movements, including disability rights, sex workers' rights, those working to prevent child marriages, rights of refugees and migrants, and the queer community, especially trans men, so that we can all amplify our voices and create safe spaces. On behalf of all our members across South and Southeast Asia and Southwest Asia, from Afghanistan to Indonesia, and from Lebanon to Japan, we endorse this call to action, and thank you all very much.
As you can see, we are not alone. We have partners who are with us and colleagues who are with us. With those few words, I'd like to hand it back to Beth. Thank you.
Thank you very much. And thank you all for joining us and to all of our incredible speakers. What we wanted to show today is the incredible richness and diversity of this global coalition who are standing for all people everywhere, for reproductive health, for reproductive rights, for social justice, for reproductive justice. So thank you all for joining us. And as you leave today, we call on all of you as well in your own hearts and your own minds, with your neighbors, with your friends, to make your own dedication, which we know you do pretty much every day anyway, but to renew that commitment in solidarity with all of us and with one another. Thank you very much for being with us. Thank you for your interest. And thank you very much to our panel and our speakers.